What's up, guys? Hope you all are doing well. I am in the process of packing my bag up because today I'm actually heading out on a trip to Dubai. Now, the reason for my trip is my leg. So if you guys have followed for a substantial amount of time, back in 2023, I had an extremely bad leg infection where they were talking about potentially cutting my leg off. I was able to get through that. I was able to come back and compete at World's Strongest Man and then Strongest Man on Earth, which was my final competition. And the after effects from that infection have not gone away. So the last couple years have been, I'm gonna say, a battle, and it's been kind of a quiet battle. I haven't shared a lot about it. You know, it's been one of these things where I have pretty much tried every single treatment that I have heard of, that I thought might work, and it's been anything from less invasive, you know, kind of massage type of stuff, treatments that I've done to myself, all the way to more invasive and super painful, like stamping, where, you know, you're going in and you know, it's just incredibly painful. I don't even want to really think about that, or I wouldn't wish that on anybody, because it was ridiculously painful for me to go through, but it did not help, is the bottom line. So I've kind of tried everything from diets to all these different treatments, and it just hasn't helped. So Ed Cohen actually turned me on to Dr. Kenn, which he is doing a special stem cell treatment. I had a consultation with Dr. Kenn. I'm super excited about this because this has me concerned. The leg has me concerned, and you know, I didn't share with a lot of you guys, actually over the 4th of July, which was my 10-year anniversary, I was back in the hospital, leg infected again, which made me even more concerned, you know, and I don't know what that was really due to. Stress probably contributed a little bit, but overall, this is an opportunity. Dr. Kenn seemed super confident that this would be able to help me, which made me more confident, which is why I'm packing my bag and why I'm heading to Dubai. So we're gonna try to bring you guys along for the ride here, show you the treatment, show you hopefully that it works. And for anybody else out there that's had a cellulitis infection and is dealing with this, maybe, just maybe, it can help you out as well. So I'm gonna finish packing, we're gonna hit the road. Just landed in Dubai. And man, that was a long second flight. I connected through Newark, and then that second flight just kind of, you know, drug on a little bit, but I think it was between 13 and 14 hours, which is certainly a long haul. I'm happy to be off the plane, walking a little bit here, get through customs, make sure my bags made it.
A few moments later.
Made it through customs, everything was just fine, other than they really didn't understand what the heck my Beyond Power unit was in my bag. So I pulled it out. I'm trying to make, you know, lifting gestures and saying that I use it as a gym, and then they had to call over a manager, and we got it all sorted out, and then I got out here and my bags made it just fine. So we are in a good spot. This is just the baggage claim area here in the airport. Pretty big, pretty extravagant, and now it's time to get to the hotel, and I'm excited for that. Made it to the hotel. It wasn't too far away from the airport. Hotel room's not bad. Shower, tub, toilet in there, and then the rest of the room, there's kind of like a little living room area, bed. So nothing crazy for sure, but gets the job done. And now I'm starving, so I'm gonna head out to eat, probably take a shower and get to bed. Tomorrow is my treatment, so I wanna make sure that I'm up early and ready to rock and roll with that. All right, guys, today is the day. I just got down here to the clinic, Zomi. I'm about to head in and meet Dr. Kenn. A little bit jet lagged from the travel, but really excited to have this all go down and to get in here and hopefully get my leg all fixed up. Let's go. Morning. Nice to meet you.
Nice to meet you. So you'll get your ultrasound in here, and then your injection in here, and then I'll take you over to another room for your IV.
Got it.
Okay. Any questions on anything? I'm sure you'll have Dr. Kenn
What
for a
is
bunch of
this?
stuff.
Is this?
This is actually your IV bag here. I fixed it already.
Okay.
Yeah, so we have your stem cells, your exosomes, and your cord blood plasma was all in here, and now it's all mixed into here.
Wow.
Yep.
Awesome.
Yeah.
And what, before, I'm assuming, does Dr. Kenn do this?
He'll do, Dr. Kenn, for you mean?
Yeah.
He'll do the leg injection
Okay.
for him and Dr. Saeed.
Okay.
He'll guide him, and then IV I'll do.
This is mainly where the where the infection was bad, and that was like 2.5 years ago. Was the initial one, and then it seems like scar tissue, but I've just had kind of constant problems.
Pain and
I wouldn't say pain, it's like uncomfortable.
uncomfortableness. That's changing with the regular workout or walking or anything.
Not really, no.
No, so
No,
it's always there.
It's kind of always there. Yep.
Here seems the worst. Here is I
We should
feel the
pick the thickest area
Yeah.
to inject.
Okay.
uncomfortable
We have
staying.
one.
No, it's fine, yeah. So the ultrasound will just kind of give us more information about
Yeah, sure.
about what-
The ultrasound give us some information about the venous
Okay.
and lymphatic and some other tissue swelling. So if there is an effusion
Got it.
around the muscles, and we can see that.
Oh, beautiful,
Yeah,
okay,
yeah.
okay.
So that will help us.
Awesome.
It's fibrotic.
Calcium.
Calcification. Bone. Yeah, muscle.
I want to show you the difference between this one. When I check it here, see
Oh, yeah.
the difference.
And the smoothness of muscle has changed over there. That's the main root of problem is there, fat diffusions.
Yeah. The veins, super.
Oh, yeah, I saw that.
Veins are compressible,
Ah,
but
yeah.
arteries are not compressible.
Okay.
We
And
have-
vein looks fine, yeah?
Yeah.
Okay, yeah, we can do the IV.
Okay.
Okay. And then we do the local.
Got it.
So
We repair the
you,
stop and.
yeah, you can get your IV.
Do that part first.
Yeah.
Okay.
Hello.
How we doing?
I made it. Sorry.
Awesome.
Sorry, I'm late. Yeah.
No, that's great. It's great to meet you.
Yeah, nice to meet you.
Awesome.
I guess you're as big as I thought you'd be. I heard they couldn't get the blood pressure cuff on.
No.
you. Common problem.
Yeah,
So,
100%.
Yeah.
100%.
Yeah, good to see you here.
Absolutely.
So yeah, we were talking about it. So so the history. Did you had a leg infection before, right? You said
Yeah.
Yes,
Yeah.
like 2.5 years ago.
2.5 years ago, and that was on this leg,
Just like,
and this is the one that's bothering you.
yeah,
mainly.
yeah.
Right. So where does it bother you the most? Like where? Like what?
It's
what's the,
all lower. Like this part is kind of where the infection was,
okay.
or I guess that was kind of like the main kind of epicenter of it.
Yeah.
When it happened, and just since that infection, it's just been like this. Like it's just stays bigger. Like I do. Like I was explaining on the phone, I do sleep with it elevated, and
Yeah.
that does help. But
Yeah.
it's not like.
Yeah.
It doesn't go away, and then once I stand up, it's like, okay. During the day, it just gets more.
Yeah.
And then, it's it doesn't get painful, but it's uncomfortable. It's just like,
Yeah.
like if you feel like it's swollen,
But it's not. The other side is okay.
Yeah.
The right
yeah.
side is fine. So
Yeah.
it's not bilateral. So he's saying.
No, it's just
So it's
your
more.
back.
I mean, the
That's
sense
the
his
same
discomfort.
thing.
His discomfort.
It's,
is only on the
complication
one
after
side.
cellulitis, It's
Yeah.
more affected on the other
Yeah,
side.
yeah. So and it's not like. So it's really just this area.
Correct.
Okay. And then so here. Yeah, I mean it's just. So this. What did you see here on ultrasound? Was there any?
Edema, not fibrosis.
Just edema. Just
Yeah.
swelling.
Swelling, yeah.
Okay. And okay. And if you talk to you a little bit, I guess you've been talking to him.
Yeah,
about
yeah.
that stuff.
We talked about the difference of local injection of mucosal and
Yeah,
systemic.
the systemic, that is more designed to help hopefully some of the vascular system, right? Because your veins probably aren't working as well as they should be.
Makes sense.
And then I think we'll do some local into that area where it's kind of, the soft tissue there is dysfunctional. I'm surprised. I thought you'd have scarring. She said she didn't actually see any scarring. She
Oh,
just saw
wow,
swelling.
okay.
Yeah,
She just found some swelling around the tissue.
Okay.
So it's chronically inflamed basically.
Got it.
So the idea with the local injection is to get that chronic inflammation down.
Interesting.
And then, because that swelling is, I'm assuming, is what's causing you the discomfort, right?
Makes sense.
Yeah.
Yeah.
So, and that's inflammation at the end of the day. So.
Okay.
So we gotta get the veins working better, and we gotta get that inflammation down. Those are like the two things.
Awesome.
what we got to focus on. So
No, that's great.
we'll see. Yeah, great. I mean, I'm sure the flight didn't help, the long flight.
No, yeah.
When was your flight?
I got in last evening.
Oh,
Yeah.
okay.
Yeah,
So
yeah.
probably parts of it is.
Yeah. I was gonna after a 13-hour flight,
Yeah.
it's gonna get worse. So
Yeah,
Yeah.
probably part
yeah.
of it is for that, and it shouldn't be that big when you are back home.
yeah.
No, hopefully, yeah.
Yeah.
Hopefully this
Yeah.
this helps. It's
Yeah.
I'm really excited.
Yeah. No,
Yeah.
we're looking forward to working with you and getting this settled down. We don't want you to do anything too strenuous for the next few days. I'd love to work out with you, but that's a
Sure.
we do a light workout maybe.
Yeah. How does that work? Are you not supposed to?
No, you can actually train like training wise. We usually recommend just a few days to take it easy. Like don't do any like usually the first 2-3 days. We don't want you to do like max out or anything.
No,
like
of
that, right?
course.
So,
But just light training.
light training is fine.
Okay.
Yeah.
Like if you were to train really hard and you broke down.
Well, the
Would
idea
that- would that cause-
Well, because then the mute cells will kind of get distracted, let's say, so to speak. You know what I mean?
That
You kinda-
was what I was
Yeah,
curious.
yeah, exactly. You kind of want them to go to the problem area.
Sure.
And if you're breaking down muscle, then a lot of them might just go to muscle repair and do
Sure.
that stuff, right?
Which we
So-
know we wanted to go there.
Yeah. So that's the logic behind that.
It's so cool.
Yeah, exactly. It's like a next generation cell therapy, right?
Yeah.
And that's the thing, like a lot of stem cells is like marketing and hype, unfortunately. And so
Sure.
it's been around, there's been so many stem cell things promoting and but they were just like not, they were just using the old stem cells, which for the most part die in the body.
Sure.
So that doesn't mean you can't get results, but it's just like, it's just not true regeneration.
Not as
Not what you're
effective.
looking, not as effective, exactly.
Yeah.
You don't get that consistency of results. So that's
Sure.
why now you can get more consistent results, which is why I think this stuff is going to obviously become, more mainstream.
Absolutely.
So,
Yeah.
So Tokta, maybe we just mark the area really, and then just tell us the depth, and then you can do the injection. Just
Okay.
it's super. It's very straightforward. It's just straight. It's not a tricky injection, obviously. We're just gonna use an ultrasound to make sure we get the right area. But like just to be clear, it's basically like here down, right? Like
I would say so. Yeah.
Yeah.
That was like the main
area.
infection spot, and it seems to be kind of like this.
Yeah.
Is all
We inject around not the thin skin.
No. Yeah.
Around the old.
Yes.
I think that's the best.
Yeah, and then
policy.
yeah, exactly, and then maybe a little bit here too.
Here
Yeah.
and go.
Yeah. So if you can just mark the areas maybe, and then he can just put it straight in.
Yes.
1, 2, 3. 2, 3. 1 cc each injection is enough.
We have two. We have a lot. So
We have 10 cc.
Yeah, exactly. Yeah, so we have a
So-
lot. Yeah.
so
Okay,
what-
I got some extra for him, so we can just be pretty generous with it. Yeah. So it could
Okay.
be like 1 cc spot. Yeah. Is it painful?
That one wasn't. No. Right now, I mean, it doesn't feel too bad going in. It's just kind of some obviously injections, but
I haven't
Yeah.
seen him flinch yet, so
Yeah.
I think he's doing pretty good.
Doing all right.
He's doing pretty good.
I'm going to spray. Okay.
okay.
It's just an antiseptic spray. Prevents infection. It forms like a little
Yeah.
dressing.
Okay.
Prevents bleeding and infection. But nothing will bleed. It's not like there's just part of it. I'm gonna train all my kids. I'm sure you're gonna do yours. I want to teach them all how to. And then
Sorry about the pain.
Oh, no, man. A couple were a little spicy, but yeah.
All right, well that's it. It's pretty
That's
easy.
awesome.
Pretty easy.
So that was 10 injections.
10 injections.
Yeah.
Got it.
Actually, 11. I
Okay.
think one of them half cc. So
Yeah.
Okay.
It was like 40 million of the Muse stem cells, which is a pretty high dose for that area.
Awesome.
So like I said, we wanted to be generous and make sure we get some good healing going on.
Yeah, that's
Yeah.
incredible.
Yeah.
So with this, just take it easy.
Yeah,
Just take-
yeah. I
take
mean-
it easy, Ken.
So I covered the whole area, and after like 24 hours, you can remove
Okay.
remove it. And
So leave it on for 24
Yeah,
hours.
for
it. If you
Okay.
can, yeah.
I got it. Just finishing up the IV here. We got the injections done into my leg, and I had a great conversation with Dr. Khan about everything. He seems super optimistic about treatment and the effects that this is going to have for me, which makes me even more excited. I can't thank him, the clinic here, Eternal Health, enough for helping me out. And the trip over to Dubai, I'll tell you what, if this treatment helps, which it is going to, it is 100% worth it. So Can't say enough good things about what they've done for me, helping me out, and the future looks very, very good. This has been a tough journey the last couple years, you know, after that initial infection in my leg, and you know, now getting to this point, I'm very optimistic about where things can go, and you know, I hope that I get help, but I also hope that this video can help out other people out there that are maybe going through the same thing, you know, where these stem cells can be life-changing in a lot of circumstances. So appreciate all you guys checking it out, and hope you're all doing amazing. Now going to be great. We'll check you guys later.